Hello, my name is Shannon, and today we are going to discuss diabetes and the nursing management. In class, you have already studied the diabetic process. Let's have a brief review. There are three categories of diabetes: type 1, type 2 and gestational diabetes. Type 1 was previously known as juvenile diabetes. It is usually diagnosed in childhood and young adulthood. These patients are always insulin dependent. Type 2, also known as adult onset, is the most common form of diabetes. It can affect both adults and children. Type 2 has more of a genetic basis than type 1, and is more affected by lifestyle. The third category, gestational diabetes, occurs only in pregnancy. You will learn more about gestational diabetes in your mother-baby rotation. Because diabetes is a chronic disease, and it affects millions, there is no doubt that you will encounter diabetic patients on a frequent basis. Throughout your nursing career, you will care for diabetic patients who have been admitted for problems such as heart disease, kidney failure, and infections, to name a few. These debilitating conditions cost billions of dollars each year in health care. So, it is of utmost importance to understand the disease as well as nursing interventions to help lessen the impact of the disease. Since diabetes affects all major organ systems, the primary goal for all diabetic patients is to keep their blood sugar under control. The definition of under control will change with the situation. For example, a pregnant patient would need different requirements for blood sugar ranges compared to an elderly person or a 6-year-old. When thinking about care plans for diabetic patients, it is important to make the care plan fit the person. Not every nursing intervention will fit every patient's situation. The care plan can be, and should be, revised as needed. Also, any nursing diagnosis should always be prioritized. You would not want to address the diagnosis of self-care deficit before an effective airway clearance, now would you? When creating care plans, there are many issues to consider. What is the patient's learning preference? Are there any language barriers? What about cultural issues? Is there proper family support? These are just a few of the questions that you should think about before you start and while you are creating your care plan. You should also think about how the patient feels, because shock or denial can affect the learning process. Can you imagine eating whatever you want for your whole life, and then all of a sudden being told that you have to limit your carbohydrate intake? Also, because discharge planning begins upon admission, it is part of your job to try to provide as much information and resources to the patient as possible for them to refer back to after they have been discharged. Okay, so let's talk about your assignments. Below is the case study for your evaluation. Scroll down to the bottom of this page so you can see the case study. Let's read it together. You just came on shift, and one of your patients is a 26-year-old newly diagnosed diabetic female. She is 5 feet 3 inches tall, and she weighs 180 pounds. You were told in report that she had been crying since she was given her diagnosis. Your report on the patient also included that the patient is married, but the husband had not come to see the patient. When you enter the room, you find candy bar wrappers, empty bags of chips, and several empty cartons of ice cream. The patient tells you, "Junk food is the only thing that helps me feel better in times like this." The patient then tells you that she doesn't think her husband would understand because they just got married, and he wants to start having children right away. The resources page has 3 articles and 2 websites for your reference. On the discussion blog page, you will find your 2 assignments. The first assignment is to post your responses to the 4 questions, and your second assignment is to respond to at least 2 of your classmates' posts. Be sure to pay attention to the due dates for the assignments. So, this brings us to the end of our lesson. Have fun with your assignments.